Hello and welcome to Anatomy with Dr. P. In today's lesson, we're going to be looking at some of the features of the heart. The first feature we're going to look at is the inferior end of the heart. This region is known as the apex and forms kind of this point where the two ventricles come together. The apex of the heart is located between the fourth and fifth ribs. Up at the top, if I turn the heart to the side, I can see how the top of the heart is relatively flat. So imagine removing all of these blood vessels. You can see the top of the heart would be nice and flat. That's referred to as the base. The base of the heart points up towards the right shoulder and is found at roughly the level of the third costal cartilage. Now, a couple of other features we can see. We can talk about the layers of the heart. So this outer layer, everything that we see on the outside, this outer layer is known as the epicardium. Epi means above. Cardi refers to the heart. So it's above the heart. It's the outer covering. If I open the heart up and we look inside, I can see this thick muscular layer. That's called the myocardium. Myo means muscle. Cardia means heart. So myocardium is the muscular layer of the heart. This is the layer of the heart that's involved in heart attacks. The proper medical term for a heart attack is myocardial infarction, a loss of blood flow to the myocardium, the muscle of the heart. The innermost layer, which we see as this kind of pink covering on the inside, this area is known as the endocardium. So you can think of the endocardium as kind of like a lining that prevents blood from leaking out of the heart. Now, a couple of other structures that we can see. If we look in the walls of our ventricle, we notice that the walls of the ventricle are covered with these big ridges of muscle. Those ridges are known as the Trabeculae carneae. Trabeculae means crossbar, carneae means flesh or meat. So literally the crossbars of meat or the crossbars of flesh. Dividing our two ventricles, we have a interventricular septum. So here's my right ventricle, here's my left ventricle. Inter means between, so interventricular means it's sitting between the ventricles, and septum is a word we use for divider. So it's literally the divider between the ventricles. Sticking up out of the walls of the ventricles, we have these large nipple-shaped muscles. I say nipple-shaped because the Latin word for nipple is papilla, so when anatomists saw these nipple-shaped muscles, they named them papillary muscles, literally the nipple muscles of the heart. Attached to those papillary muscles, we have these little tendon-like cords called the chordae tendineae. Those chordae tendineae anchor our two atrioventricular valves, the tricuspid valve and the mitral valve, to the papillary muscles. Now, you might be asking yourselves, why? Why do we have these structures? When the ventricle contracts, the pressure inside the ventricles increases tremendously. As that pressure increases, these valves close, and as it continues to increase, there's a risk that the mitral valve and tricuspid valve could turn inside out, kind of like an umbrella on a really windy day. That's the job of our papillary muscles and chordae tendineae. The papillary muscles contract, pulling on these chordae tendineae. That's what prevents our mitral and tricuspid valves from turning inside out as the pressure in the ventricle increases.